We told you earlier this week, pediatric COVID-19 cases are going up. The American Academy of Pediatrics reported 250,000 cases in the U.S. last week. And the Ohio Hospital Association reports cases went up 80% last week over the previous week. Amanda Fay talks with local pediatricians about what they're seeing in the office.
It has been insane. It has been, something that is completely unprecedented that I've seen in 8 years.
Dr. Catherine Davis says her office at Monclova Road Pediatrics is inundated with sick kids, booking double and triple times the normal amount of patients.
In the past few weeks, we've had a huge surge of COVID-19 cases in our office. And that's amongst the surge of RSV and croup and all of the other kid viruses that you tend to see every year.
Except normally it's not in the summer, but the winter. She fears what the surging COVID cases might mean for hospitals. 1 in every
125 cases are hospitalized with peds. That creates a huge number and a huge burden on the hospital system. And 1/3 of those go to the ICU.
The chief medical officer for Mercy Children's Hospital says it's a concern for him, too. And it's not just about open beds, but also staffing constraints.
Obviously, a lot of the doctors and the nurses and respiratory therapists have children, and as they become sick, unfortunately, they have to take time off to care for those kids.
Dr. Mills says kids who are vaccinated handle COVID better than those who aren't, but obviously those under 12 aren't eligible. He's expecting to see data next month that could change that by early next year.
To make sure that the safety is there as well as the efficacy is going to help everybody in terms of our ability to confidently move forward with when we give these vaccinations and in what time frame, and if there's a booster, what will that look like.
In the meantime, Dr. Davis says good ventilation, hand washing, social distancing, and masking kids helps. But parents, you have to make sure those masks fit well.
Whether that's a surgical mask that you can loop over the ears, double loop so it has a nice seal, or a multi-layered cloth mask that has a good fit.
She encourages to also explain to your kids the importance of keeping illnesses at bay to protect the most vulnerable. Amanda Fay, WTOL 11.